Well, March is National Colorectal Cancer Awareness Month. Colorectal cancer is one of the most preventable and treatable forms of cancer when it's found early. Here with us are Doctors Bagai and Dr. Ambrad from the Ironwood Cancer Research Centers. Gentlemen, thank you so much for joining us today. This is a really good opportunity to create awareness. So Dr. Bagai, I want to start with you. We were talking earlier this morning and I did not realize that colon cancer and rectal cancer are two different cancers.
Absolutely, that's a great question, Terry. Oftentimes they're thought of as the same, but clearly they are two different types of cancers and actually treated quite differently.
Oh, really?
So very important to know the difference between
Yes.
true colon and then rectal cancer.
Do they have different symptoms, and if so, what are they, and what are they in general?
Yeah, another great question. Oftentimes rectal cancer, which is lower down, really a landmark known as the peritoneal reflection, tumors below that are rectal cancers. Oftentimes generally with more bright blood that can be found in stools,
Okay.
whereas tumors higher up are more darker stools, but symptoms can be similar.
Okay, and unfortunately, when you see those types of symptoms, the disease has progressed at that point. Is that true?
So that's a great point, and that's the whole point of trying to detect this cancer early. We know that colon cancer is becoming more common recently, largely in part due to society's increased awareness of the disease. People are following through more with screening protocols, and we have identified risk factors that are associated with this development of this cancer and who are at higher risk. And so in terms of screening, we encourage people to follow protocols in terms of average risk patients, generally recommended to have a colonoscopy at age 50.
Okay, that's when all the fun begins,
Right,
so to
or
speak.
all the
All right, Dr. Ambrad, I want to talk a little bit about diagnosis, because this is that nobody wants a diagnosis of cancer anyway, but this type of cancer is frightening. Tell me about the type of treatments that you guys offer. We were talking about chemo radiation, which is something that I've never really heard of before.
Correct. So for rectal cancer, we use chemotherapy concurrently, is what we call it, with radiation at the same time. So traditionally, for instance, with colon cancer patients, this is after surgery for colon cancer, they get chemotherapy only. We use radiation basically for rectal cancers, but we treat patients at the same time concurrently. It enhances the effect of the treatment on the tumor.
You said you found more success that way,
Correct.
which is amazing. So one of the unique things about Ironwood and you guys are very proud of this, and as you should be, is that you work together comprehensively under one roof. Dr. Bagai, you actually even communicate with Dr. Ambrad when saying, hey, I need to send a patient over. Why is that so important to a patient's success?
Sure, so that's a great point. We really feel that not just colon cancer, but generally cancer itself really should be treated in a multidisciplinary fashion. So we work very closely with our primary care physician colleagues, in colon cancer with our gastroenterologists and surgeons to formulate a plan and move forward together as a team.
That's really important, isn't it?
Very important,
Yeah.
and patients really appreciate the constant communication between their doctors who are part of the team.
Yes, we want everybody on the same page. And Dr. Ambrad, real quickly, I'm just curious, is colon cancer or rectal cancer, is that hereditary?
There are some cases of colon cancer that can be hereditary. Hereditary polyposis syndrome, for instance. So if you have a family history of having polyps at a young age, then you definitely want to go in for screening earlier. But most cancers are not hereditary.
Okay, but if you have the polyps, you should definitely go in earlier.
Absolutely.
All right, and it's great working with the team as you
That's
guys
correct.
are. Okay, thank you so much, gentlemen. I really appreciate you being here. This is very, very important information. And Ironwood Cancer and Research Center, they have 9 Valley locations for you to choose from. To find one close to you or to book an appointment, you can call 480-821-2838 or learn more on their website. It's ironwoodrc.com.